Anaplasmosis is caused by Anaplasma marginality. This is a bacteria that infects the red blood cells. Typical clinical signs are fever, anemia. You may get some icterus around the eyes, or if you look in the mouth, you might see that yellow color. These animals are usually weak, they don't want to eat, they may abort, and in worst case scenarios, they'll die. Typically, we see most of our cases in late summer, early fall, that time period. So when we get to the winter, we kind of have a lull as far as cases are concerned. And that's why Dr. Coetzee from Kansas State University recommends this is a good time to have that conversation with your veterinarian about talking about prevention and control. One of the things that Dr. Coetzee has recommended is doing a herd test to see what the prevalence of this disease is in your herd. When we do that, a lot of the times we find out that, maybe a third or a half of the herd is infected and the other half is not, or 2/3 is not. If you're using a vaccine, one of the advantages of going ahead and doing this herd test is there's probably not a reason to vaccinate those positive animals. We generally assume that when we have a persistently infected cow, that she typically will not get clinical signs of anaplasmosis in case something that compromises her immune system happens. Unless that happens, these typically will not have clinical signs. So the thought process is we could save some money by just vaccinating those negative animals and leaving those positive animals alone. There are also some other controlled measures that Dr. Coetzee recommends. If you'd like some information about these recommendations, if you'll go to sunup.okstate.edu.